Hey everybody, welcome back to the channel. This is Fibro66, and if you followed me, there's another channel I have, which is DIY Rick 66. This isn't really going to be for the channel itself. Something recently has happened to me, and I wanted to share it with my family, friends, and online friends. Over the years, when I created Fibro66, it was 10 years ago. I was diagnosed with fibromyalgia for men, which is very rare. And I tried to walk people through the process which has worked for me. I've tried to eat almost like a carnivore diet, more from the earth and less processed foods, and that's helped. And I'm kind of actually medicine free. That went on for a while. Also with this channel, I have degenerative disc disease throughout my spine and my neck, and I had to have a replacement disc in my neck. So to move that along, recently within the past 7 months, something has really changed. And what happened was I was doing routine blood work, and my blood work went from like a 2.5, and then over a treatment period and different tests and things like that, it shot up to 11. So long story short, how we got to that point was with random PSA tests, it started to rise up, and to the point where it triggered my neurologist to try to do some more research into it. And we went and we had an MRI done. The MRI kind of came back inconclusive, which is crazy, but that's exactly what happened. So then that put us down a road to thinking maybe it was prostatitis, and I had an infection in the prostate. That didn't solve anything. I shot up to 11 on the PSA test after that. I had a round of antibiotics for 30 days, and then we had to cool off for like 2 months to let that get out of the system and see if the prostate shrunk back down and the antigens were lower, but they weren't, and they shot up. Then I had to have a biopsy, 14-point biopsy, and more than half of the biopsy results came back with cancer. Now, the way this works, and trying to keep the video as short as possible for people that don't really want to hang in that long, the Gleason scores, which is the cancer aggressiveness scores, they're different in prostate cancers. They start out at 5 and they go to 10. So 5 you could live with for the rest of your life and pass away from a heart attack at an elderly age. And that's just life, that's a progression, that's how it works. It can stay there and not have any major effects or anything like that. Unfortunately, mine came back 8 and 9. So we were getting to the point where this was going to get very aggressive, and then if it busted out of the prostate gland, it would have went out throughout my entire body, and we'd been in a whole different ballgame. Luckily, it was contained in the prostate gland itself. After doing multiple months of research and trying to figure out what I'm going to do, my doctor recommended a radical prostatectomy, which a lot of people do, and some of the symptoms that people have aren't that bad, and some people can have some really bad lifelong symptoms that I didn't really want to put myself through. So I went another route. It's called the Tulsa Pro procedure, and I researched a doctor named Dr. Busch down in Alpharetta, Georgia, and my wife and I went down there and stayed overnight in a hotel, and then through a 3-day process, we went ahead and had the treatment done. Now, if you've heard of HIFU, which is high frequency ultrasound, a lot of that's been around for a while. This Tulsa procedure has been around for maybe 4 years, if I'm getting my numbers correct. What they do is it's a transurethral ultrasound ablation, and they go inside of the prostate and they basically hit it with ultrasound waves all the way around, depending on the aggressiveness and the tumors that are in your prostate. Unfortunately, mine actually had tumors on the left side and tumors on the right side, and they were getting ready to come through the gland. Luckily, we caught it in time. Dr. Busch was amazing. He was the only doctor that we contacted, to be honest, that would even look at my case. All the rest of them basically wanted to just yank it out and be done with it. And I understand the theory with that. That's been the standard of treatment for years. But with now my wife and I sitting down talking about it and quality of life, I'm almost 60 years old. I'm going to be 60 here in another month. And I just felt like, I was devastated with the cancer diagnosis to begin with, and I wanted to try a different treatment. And this is what we came up with. So I was actually number 589 at the Busch Center for treatment. So he is treated now, last time I looked, around 602 people successfully. Now, the thing is, with mine, because of the aggressiveness of the tumors and the large size of them and being Gleason 8 and 9, he had to go in and had to ultrasound the entire gland. I will have some complications for the rest of my life. I'm not going to be the same guy. I'm not going to sugarcoat it. I'm spared. My life is spared for now. Every 3 months, we're going to do PSA tests randomly, and then one MRI a year. Now, you also want a PSMA test if you're going down this route. A PSMA test puts dye into your system. It will make sure that the tumor cancer cells prostate cancer in general has not leached out and gone into your bones or any other vital organs. So that had to be done too also. I'm kind of going backwards here. So that's the update. I just want everybody to know. Now, if anyone else is interested in more of this, and I'll get into we won't say gory details, but exactly what I had to do. I'm now 2 months post-procedure. So I'm giving an update to everyone, but if anyone needs any more information or contact the Busch Center, check Dr. Joe Busch and Kathy Busch and the rest of the Busch team. They were wonderful. But if you want even additional information, throw some comments down there in the comment section, and I'll go into further detail of exactly what I had to do with the procedure. The Tulsa Pro procedure, they have to go in through the urethra, up through the penis, and they have to actually do an ultrasound inside. You are in an MRI machine, in live MRI machine while this is being done, and they're monitoring it and cooling things, and they have other things that are going on throughout your body. But I'll get into more detail. If anybody wants it, just fire it off in the comments, and I'll expand this to even further. It's just been a while for me to kind of get my thoughts together and figure out how I was going to approach this. But thanks a lot, everybody. Thank you, family and friends, for supporting us. Your well wishes and your texts and messages have been well received, and prayers. Thank you all. Take care.